So next steps for the NPDA. We're in a bit of a limbo at the moment because the NPDA is commissioned on a competitive tender basis every few years or so. And so we're in the tendering process right now. We're waiting to hear if our bid has been successful. So I'm hoping that we will be, that the college will be the organisation taking the developments of the NPDA forward. And I can tell you about what those developments are because they're in the contract specification. So I'll go through the main big three things that will affect you as units, the biggest changes to the design of the audit and its scope. So the biggest change will be from moving from a retrospective annual audit with 3 months of hurried data collection at the end of that period towards a prospective continuous model of data collection. So whoever is providing the audit, hopefully us, will be developing a new platform so that you could enter data all the way through the year and get immediate feedback on what your results are. So you'll be able to see at a patient level who still needs all of their recommended care processes, what your median HbA1c is, and what your mean unadjusted HbA1c is as you enter more data into the system. So we think that's a really beneficial improvement. We think that's going to really reduce the burden of data collection. It will help you identify glitches in your extraction or your data entry through the year and attend to them quickly. It'll spread the burden through the year, so it's not such a rush in those 3 months, which will really have an impact on data quality. And most importantly, it will improve quality improvement, we hope, because at that 9-month mark, for example, you can see how many of your patients are yet to receive the care processes that they should have received by the end of the year, so you can really concentrate on making sure that they come into clinic. We were also really pleased that the Prem has been retained in the new contract because NHS England has stopped funding new Prems. Except for where there's one that's been working well. So we're going to keep the Prem, but redevelop it. So this will involve doing a psychometric assessment of the existing Prems to see which of the questions work really well and which ones could be redeveloped. And then we'll develop new questions with patients, parents, families, and also with staff in clinics to make sure that we're asking questions of patients and carers that are really going to help you improve your service to them. So we're going to pilot the new Prems on a few volunteer units so that we can then psychometrically analyse the data that comes back and make refinements before we roll it out nationally. So what that means is there's not going to be a Prem this year. So if you are required to be collecting patient feedback for any other purposes additional to the NPDA, you're going to need to make your own arrangements. And lastly, we're going to be delivering spotlight audits. So these are audits that are additional to the core audit that we collect every year. And this will enable greater focus on aspects of care that don't necessarily lend themselves well to annual review. So maybe structured education, or looking at going into greater detail at a patient level or a service level to help us identify inequities of care, but also to just, so for example, structured education, it's not necessarily something that you can audit every year. There are different models being delivered, and we might want to know what models are being delivered, how they're being delivered. And the first table work session, we're going to ask for your ideas of what we should be looking at in these audits. Other developments, we have developed, well, we're in the development phase of a new interactive online reporting tool, and hopefully I'll be able to show you this now. It's a test site, so it's glitchy, it's still in development. We've loaded up the data from 14-15, just to give you a sense of what's coming. Yay! So, this is what it's going to look like on the front page. You'll be able to download your annual report, the annual report for CCGs. You can see your data at network level. So you can choose the year of focus for annual report. Select your hospital. We'll go with Arrow Park. And then you can select the measure that you're interested in, And you'll be able to select other units, or if you're looking at a regional level, other regions, up to 3 to compare on each measure side by side, as well as your local region and the national average. And you'll be able to download this data in an Excel file or as images to help to put into presentations. So we're quite excited about this. We think it will be really useful, and we really hope that it's going to support quality improvement in your services. Okay. We're also going to be collecting a new data set from April 2017. The data set will reflect changes to the NICE guidance that have been introduced since the data set was originally devised, and you'll be pleased to know that there are fewer items, so the burden of data collection should be reduced. And we want to have more events like this. In your packs, there's a feedback form, and if you've got any ideas of things that you'd like us to do, we've got a big room at the college, and it's quite cheap for us to use that. So we'd really like to encourage you, if you've got any ideas for stakeholder events that you might like to attend, please let us know. We'd really like to facilitate something. Obviously, should we win this contract, we're going to be really busy. So if it's something that you want to personally take a lead on, that's great. We'll just provide a room and disseminate information about it. I don't think we've got time for questions, so we'll be around all day. So if you've got any questions about this, please find me or Mark, or we've got Nayan at the back there. Wave Nayan. And where's Mel? Hi Mel. So Nayan, Mel, me, Mark, if you've got any questions about what I've presented, it'd be great. So rather belatedly, let's hand over to Ragnar.
Thank you very much.